So we think that all of the shifts that the 10-year plan proposes are really important, but where we're concerned, we think the biggest potential for impact is actually in the third one, the shift from hospital to community. And that's what we had the opportunity to discuss with the Secretary of State and his team when there was a round table that we organised with King's College London, where we brought international experts from 10 countries to share what they had learned from implementing that shift. So we know from international experience that it can be done, that it can be done at pace and at scale, and it delivers very important wins in terms of reducing health inequalities particularly. But we also know that it can be done here in England. So we've just wrapped up 3 years of research funded by the Economic and Social Research Council through the Transatlantic Platform, working with partners here in Brighton and Hove, but also in Brazil and in Canada, looking at 3 cities, Brighton, São Paulo and Toronto, in how they responded in innovative and effective ways to the challenges of the COVID-19 pandemic. What we found here in Brighton and Hove was that frontline decision makers, both in the NHS and in the council, were able to get out of their silos, out of their more bureaucratic ways of doing things, and develop agile and effective decision-making mechanisms that were able to connect in new ways with community groups, particularly from black and racialized minority groups, and that they were able to speed up grant making and reach people who hadn't previously had access to resources. And those people, because they had the trust of the communities, were able to tackle challenges like people being reluctant to take up vaccines. They were able to do that because the trust existed, and the decision makers in the NHS and the council trusted local people to reach out to the people by whom they were trusted. So this is what one of our partner researchers in the work on food in Brighton and the innovations in the food system in response to the pandemic calls moving at the speed of trust. So we think that's a really key lesson, and it's a lesson that we also picked up from São Paulo and from Toronto. And Toronto in particular, they were able to go even further than here in Brighton and Hove, because in their health system, unlike the NHS, which is historically quite centralised, in the Canadian health system, community-led primary healthcare providers, like Taibu Community Health Centre with whom we worked, which is a black-led, community-owned primary healthcare provider, essentially a big GP surgery, is commissioned directly by the Ontario Health Ministry to provide services to some of the poorest neighbourhoods in Toronto and a majority black population with an Afrocentric approach to healthcare. And Taibu were able to build on the strong links they have with the community and the trust that they'd built to deliver not just vaccine outreach, but a range of other services around food and other wellbeing challenges associated with the pandemic. And they were able to do it again at scale because of the trust that existed and because they were trusted with decision making and with resources. We saw it also in Brazil, where primary healthcare, as in many countries, isn't nationally controlled. It's devolved to the municipalities. So a city council, in this case São Paulo City Council, can establish innovative partnerships with local community groups to respond quickly to emerging challenges. And they have the resources and they have the remit, and crucially, they have the mechanisms for citizen participation and oversight to ensure that there is local accountability and that health systems are able to adapt and respond to changing local realities on the ground. So we know it can work, we know it can work internationally, we know it can work here in England, and we hope that the Secretary of State will follow through on the really important and valuable intentions set out in the 10-year plan by supporting genuine devolution of decision making and resources to frontline health system managers, local councils and crucially local community groups.